Welcome back everyone to Acts on Health. This is our first educational video that my wife and I are very passionate about and will be up on our Instagram, but we also wanted to talk about it here on our YouTube. And that is fear avoidance when it comes to pain specifically. So the research shows that we are now moving towards a BPS, a biopsychosocial model of pain care. So what does this mean? The research shows that pain itself is not just a physical or somatic sensation. It's not just the physical attribute of pain fibers sending up signals through the spinal cord to your thalamus and in different areas of your cerebral cortex. There is more to pain than just the physical attributes. So what does this mean? When it comes to chronic pain, and chronic pain is affecting, research shows different things, but between 25 and 45% of the population at any given time. And most people will experience a chronic pain disorder at some point in their lifetime if they live the average life expectancy, which I believe is 78 right now. So what does that show about how to deal with pain, how to go about dealing with the treatment protocols that aren't just, the acute responses from, say, hurting yourself. So let's use low back pain, okay? So when someone has an injury, an acute injury, so let's say an acute tear in their annulus fibrosus, which is the outer area of your disc, and in the gel in the middle, your nucleus pulposus comes out, compresses lateral stenosis, and causes a impingement on the nerve root, or chemical inflammation, which is what the majority of the pain comes from. Now remember, your discs, your bones, your ligaments, they don't feel pain. The human feels pain. We perceive pain. Those areas are not feeling pain. This is why some people can break their leg and not be in as much pain as someone can stub their toe and, be very upset about it, psychologically speaking. So fear avoidance is very good in the beginning of a rehab protocol. If you break your leg, you don't want to be jumping on your leg right away, common sense. But, over time, when, say, the anatomical or the tissue pathology is healed, and we now have a chronic pain pattern, something is going on more than we thought, or the researchers thought, than just, give this person, long-term NSAIDs, or give this person long-term opioid use. And by the way, I am a chiropractor, so I cannot speak on medication, but I'm just giving an example of what happens in practice in all realms of medicine or chiropractic physical therapy. So fear avoidance now, what they've seen in the research, is a big predictor of disability, big predictor of depression, avoidance, all sorts of things, which makes things from an acute stage to a chronic stage. And this is where a lot of people are stuck because they're avoiding things. So it's plain and simple. When you show your brain that you are scared of something, your brain brings it up more and wants to protect you. This is a basic evolutionary response that we have built into our brains from a long time ago. So flight or flight response, your sympathetic nervous system, and a bunch of other things that's going on is trying to protect you. It doesn't want to it's not malicious. It just thinks that there's an actual problem. So a couple things right here, and I'm going to link some of these sources down below. But I want to talk about, what is catastrophic thinking? So we have rumination, consistent, like, oh my gosh, I can't stop thinking about this over and over and over again. Then we have magnification, so you blow it completely out of proportion. And then we have helplessness. So, oh my gosh, I'm hopeless, I'm never going to get better, so on and so forth. And then this leads to maladaptive thinking. So, overgeneralization, filtering only out the negatives for the positives. And this, what they've seen in a practical application, is people are not confronting their fears through a graded exposure response and getting over these fears. Because what happens is you're so sensitized to the condition when there's no longer a severe damage to the actual tissue, or like I said, anatomical, there's not something wrong, it's more in your brain. And that's a hard thing to tell people because patients will say, what do you think, I'm crazy? That's not what I'm saying. You have sensitized yourself to this scenario, and then now what's happening is your brain is bringing this up more often than it likes to. So, and that's really how it works. So, a good representation is, you have a pain experience. If you go one way, you have low fear, you confront it methodically over time to recovery. But what we're seeing in a lot of people is, they experience pain, the actual tissue pathology goes down, but now they're super afraid. They're afraid of their pain. Now they're avoiding activities they should be doing to help them recover. That leads to disability and depression, and now you're stuck in this loop for long periods of time. It's a really unfortunate thing. And your brain learns really fast. That's what neuroplasticity is. Connecting these new synapses, just showing a rewiring, just, oh my gosh, I'm afraid of squatting. Oh my gosh, when there's nothing structurally wrong with you. So this is something I think is really important because, you don't need to go into the in-depth anatomical, physiological, neurobiochemical aspect of it. But when you look at it from a sense of, okay, pain is a lot more multi-factorial than we thought, this brings us into something now we can lead a rehab program into a more specific, catered, graded exposure. Obviously, if you're deathly afraid of squatting after an injury, not just gonna be like, oh, hey, let's squat 95%. Graded exposure over time. Show your brain there's nothing to be scared of. And then over time, that fear, anxiety comes down, helps you to be able to recover faster. So I hope you guys enjoyed this video. Remember, fear avoidance, excuse me, in the beginning can have some really good benefits. Again, don't want to jump on the broken leg. But long term, if not taken care of appropriately, this can lead to a chronic pain condition. I hope you guys enjoyed. Thank you for listening. Have a good day.